Angie has been a medical doctor for over 20 years, and for most of that time concerned with people who experience pain often for every minute of every day. These patients often lose sleep, lose their jobs, and end up on a financial and personal downward spiral. They are often depressed and on multiple pharmaceutical drug regimes, but still suffering in pain. What is striking about these patients is that many do not even have a diagnosis. They do not know what is causing their pain and ruining their lives.
Jason came to me with over 30 years of pain. He was unsure where his pain was coming from.
It was torture. Every morning I would wake up in agony, and through the night as well. Sometimes the pain would get so bad that it felt like someone had like a saw in my stomach, just going back and forth, or around near my hips, just back and forth, and it wouldn't stop.
I talked to Jason and took a story, and this alerted me that his hips may be a source of his pain.
We went to his clinic and he pulled up an old scan that I had for kidney stones a few years back.
I proceeded to look at Jason's kidney scans that he'd had in 2011. And these showed his hips at the periphery. And the scans showed it looked like his hips were worn. There was some cartilage that had thinned.
And he pretty much immediately spotted something. I was a little disbelieving because I've had a lot of doctors initially point out something.
Jason's MRI confirmed his diagnosis of hip pain.
The pain is, it's always tended to move around, but mostly it's focused on my hips and my stomach area.
The MRI scan showed narrowing of the cartilage, as well as the presence of cysts in the adjacent bone. Once cysts are present, a joint almost always causes pain. Pressure on the bones in the joint is normally absorbed by the cartilage, but was thinned in this case, and this created the cyst in the bone. The pounding on the hip joint on the cyst was creating electrical signals which were travelling to the brain and experiences pain. This was creating Jason's pain for over 30 years. And then we started managing Jason's hip pain. Basically, if we relieved the pressure on his hip, we would get less electrical signals emanating from the hip joint and from the cyst.
Oh, my life's changed quite remarkably.
Jason was advised to change his activities, perform less walking, do more swimming, and what he found was over 6 weeks he stopped all his medicines for hip pain except a few analgesics a week.
I stopped taking medication for one, so that was a huge thing, and I began a physio as well as regular swimming, sort of aqua jogging, and also using a sauna. And I have minimised my walking, which is a big part of my pain, so I limit what I do, but the pain has become much more manageable. I haven't experienced extreme pain for quite a while now, which is it's a good feeling.
A definitive diagnosis of Jason's source of pain can now allow him to live an essentially pain-free life after 3 decades of suffering.
Approximately 15 months ago, I developed a pain down my right side and groin area.
Steve Tarpley was another patient who came to my clinic without knowing the diagnosis of his pain.
I went to my GP and they initially thought that I had kidney stones. So they sent me for a CT scan, which was clear. I ended up having approximately 3 trips to A&E over approximately a 3 or 4 month period, just developing severe pain. For one of the visits, they thought I had a twisted testicle, but that proved to be not the case.
Despite 2 years of investigations, Steve was still no wiser as to the source of his pain.
They sent me to a urologist who did tests, and he couldn't find any. He said it seemed to be all fine, but he sent me I had a colonoscopy, which was also deemed to be clear.
I talked to Stephen, took a story about how his pain was created, as well as examined Stephen, and I had an idea that it was probably his back. To check the diagnosis, I checked his old x-rays, and there was a kidney scan that showed his back. And in the kidney scan, we can see that the disc here is narrowed compared to this disc above. Now the discs in the back are designed to absorb pressure, and so that the bones don't get pressure. Once the bones get pressure, electrical signals travel to the brain and can create pain.
Within probably 10 minutes, showed me where he thought the problem was arising from.
Once he knew what was wrong, he was able to reduce the pressure on his back, as well as have treatment to stretch his back and his muscles.
He gave me a recommendation that we do some deep massage therapy on my side and glutes, and within 6 to 7 treatments with a deep massage therapist, the pain had predominantly gone away.
This caused almost total resolution for Stephen over 3 weeks.
I'm really excited about working with Goresh Kanji and being part of the New Zealand Pain Foundation. And mainly the reason why I'm excited about this is that I'm working with Goresh in his PhD, and this really opened up my eyes, I have to say, and saying we cannot rely on medications all the time for treatment strategies. We need to be looking at other ways of helping people that have chronic pain, because chronic pain, people that suffer from chronic pain, it's debilitating. The reason why pain management or with self-treatment, non-invasive techniques is really important is that it's just another means for adding in the toolbox of treatment strategies. So in that toolbox of treatment strategies for people that suffer from chronic pain, we've got our medications, and we've got the World Health Organization pain ladder that we follow, where we add in our analgesics plus our adjunct drugs to help. That cocktail of drugs are there to help those people that suffer from pain. But as we've found, there's hundreds of thousands of New Zealanders that suffer from chronic pain, and that cocktail of drugs is not helping them all. And so we need to be thinking of other treatment strategies, and that's why we need to be looking at these non-invasive techniques. We want to have non-invasive techniques or treatments that don't have adverse effects, such as the pharmacological means that we're currently reliant on, and that people can go out and, as we call it, self-treatment. They can going to a sauna, for example, or meditating. They can use those techniques themselves and build it into their lifestyle to help reduce their chronic pain.
I'm very proud to be a member of the New Zealand Pain Foundation. I've known Dr. Kanji for many, many years, and I think what he has started is a fantastic opportunity for hundreds of thousands of patients in New Zealand and potentially around the world to develop novel solutions to many aspects of pain, and hopefully not just relying on old-fashioned models of treatment. And this foundation is all about the future and research.
What we need to do is provide the evidence to show that these self-treatment strategies are pertinent and do work, and that's what the New Zealand Pain Foundation is about, and that's what my work with Goresh and our research that we'll be doing at Massey is all about, is providing the evidence to show that these self-treatment strategies are just as pertinent as the cocktail of drugs that are present.
Over the previous, like I say, 12 to 15 months, the hospital and surgeons and neurologists hadn't been able to identify where the issue was arising from, and here I am within 10 minutes of sitting in Dr. Kanji's surgery, being told within 10 minutes that he could see where the problem was straight away. So yes, I was a little bit upset, to say the least, that I'd been over a lengthy period of time in discomfort, and within 10 minutes it had been resolved.
After that MRI, when Dr. Kanji brought it up, it's just good to see them black and white. And that it's not in my head.
The New Zealand Pain Foundation has been set up to help patients just like Stephen and Jason. The foundation will work with Massey University to deliver groundbreaking research to help thousands of New Zealanders who suffer from chronic pain.